earlier, where do you guys see this research program within the next 3 years, the next 5 years, just in the future? How do you see it evolving?
Yeah, I mean, we're continuing to work with the partner sites and trying to support them in disseminating this information. So I think continuing to do that. I think one question that comes up with sustainability is like, where does something kind of live? So we can continue to be available to folks, but to have that support be available in a more ongoing and clear way. We're fortunate that there are some other mechanisms in place to, I think, continue that. So for example, the DC Autism Collaborative that Serene mentioned, there will be a focus there, I think, on kind of this workforce development and education piece. But then Dr. Ingenietta can talk more about Echo Autism, and that did not directly come from this project, but I would hope that the partnerships that came out of this project and will lead nicely into that work that they're doing.
Yeah, I can jump in. So as a primary role, being a clinician, it was just a great experience to be a part of this project and to start to put, like, I didn't even know names of some of the counterparts in early education. I certainly knew organizations, but I didn't know the people that actually ran them. And now I do, which is hugely helpful. And now we have this ongoing way to coordinate with them through the DC Autism Committee, which is so fun. This other extension of projects like this is something that we're doing called Project Echo. And this is, we're a replicating site. This is a very, very cool endeavor that's put forth by the University of New Mexico. It originated in a medical discipline, and it's applied to broadly to wherever there's kind of a big systematic problem. And caring for kids with autism is a big systematic problem for a lot of centers because of the weights and because of the sheer numbers of kiddos with autism spectrum or who have concerns for autism spectrum. So it's something that everyone's trying to tackle. So Project Echo uses a hub and spoke model and really works to train, to have sort of a group of specialists in autism, including Yetta Myrick, our parent advocate, who are basically sharing knowledge with a community of professionals that can be, our target communities are primary care folks, other specialty disciplines like developmental peds, psychology, speech language pathology, OT, social work. And then we have a clinic that's going to focus on early educators. And we're likely going to broaden that to just school and early educators because of the needs. But it allows us to have this kind of ongoing communication with our counterparts who are working with kids in their school systems or working with kids from very early on, and help support their ability to care for them. So in a very individualized way. So the cool thing about Echo is it's case-based learning. So these participants are going to come and talk about, their particular issue that they're having with a kiddo on their kind of treatment roster. And then we get to help triage that kid. And then they learn what they learn will help them in managing the next kind of autism related concern they have. So it feels really, it feels like a nice bridge between big picture, but also very individualized in terms of helping a clinician with what is exactly in front of them.
Yeah, I was going to say, if I may just say, I think the other thing when I think about Echo, like the motto is all teach, all learn. And so it provides a space for us all to learn from each other, right? Like we're supporting each other. This gives Dr. Inge and the rest of the team who, they're working up the Center for Autism, right? It gives them a bird's eye view of like what's happening in the community. And as a parent coming into this work, right? Like I'm navigating and interfacing with all these different groups of reality is when you're a clinician and you're in these spaces, it's your view is a little bit narrow, and there's nothing wrong with that. Like, you have to be a specialist in your field, right? But I think this gives regular peeks into like what is happening, you know, beyond the clinic, right? And I think it's very satisfying. Like, we get, I want to say every time we've done a clinic in the past few months, like Annie's always like, this is so fun. And I mean, like, it really is, because we are really like sharing information and getting information back. And it's just really reciprocal and very rich. And I think, you know, that's the reason why we all, no matter what discipline, whether I'm a, you know, parent, yes, you know, who knew I was gonna have a kid with autism, but like, not every parent like goes into this work, like into this work as a parent. And so it's just really, I think, rewarding to be doing this and seeing, you know, everyone coming together, because there is passion and there is care and love for this work. So I just, you know, it just makes me very full when I think about it.
If someone was interested about learning more about the train the train model or any of your initiatives, I mean, how would someone go? Is it posted on a website? What are some of the the resources also, or maybe possibly Toolkit? Are they available online?
That's a great question. They're not right now, in part because I think we try to individualize the trainings, like depending on the group that we're working with. So I would say if folks are interested in learning more, they can certainly reach out to us and we can share materials or like talk with them about that. But right now we don't have them out, so that's something good to think about. Yeah, I'm trying to think if there's any other, I mean, we could also point to, we have through, I mean, in part through this project and then through some of our other autism related work, could point folks to some standardized materials that are available online. Like there's a primary care, an autism toolkit for primary care clinicians that just came out that we were able to help inform, and you know, some other things like that. So not specific to these trainings, but to some other resources.
I will add that some of the trainings that we did put together came from already created resources. So we didn't create them all from scratch. A lot of them came from other places. And I'm gonna let Yetta kind of give a plug in for some of her resources, but a lot of it came from materials from the CDC, which I'll pass it on to Yetta to share.
Thanks. So another one of my hats is that I'm the Centers for Disease Control and Prevention's Learn the Science Act Early Ambassador. So I became the ambassador in 2016. At that point, every state didn't have an ambassador. Now we actually do, but basically the CDC created free resources for families of children 0 to 5. So this is even before you get to an autism diagnosis, if there's a concern, to really learn about basic child development. You know, what are developmental milestones? You know, if I have a concern, you know, there's a sheet that literally says, how do I talk to my doctor if there's a concern? You know, there's an app, checklist, all of these great resources, children's books, all for free, right? And so that was a part of the training, like really, okay, autism is obviously a big part. Like, how do you, get families those resources? But before you even get there, do you know what developmental monitoring is? And like, in terms of like medical, providers, the term is developmental surveillance, right? So that's the medical term, but CDC really wanted to make it accessible to families. So like, there's a part in the training where I go over like learn the science materials, what is developmental monitoring, how do you get from developmental monitoring to the screening, right? Which doctors are doing screenings all the time, the school systems are doing screenings. There's some overlap. And then if, even further, if there's a challenge with that screening, the child then goes for evaluation, which is where, a CASD, for example, might come in. So it really is like looking at taking folks, from the very beginning, before they even get a diagnosis, because that's really where this work came from. Like when you look at the wait list, right, all across the country, families need resources to help even get them there, because we, as I've said earlier, we just don't know. And so when everything is kind of laid out for you, that I think is really a help for families to figure out how best to navigate. Then we come into a little bit of a problem when it's like, okay, with the schools, everyone technically can get access to those resources. Might be a little bit of wait, but there also are things within the law where you can't wait over a certain amount of time under the Individual Disability Education Act. But then when it comes to, well, what happens medically, I need that formal diagnosis. That's where we're seeing a little bit of that clog. So then that brings us back to an ECHO model, right? Where you have a provider who's in the community that then can maybe get that family those resources. So again, it's just awful for me personally. It's this awful circle. It's really great for families to have access to all of these things and providers talking to each other and like figuring out how this all the pieces fit together.
Are there any other highlights that you wanted to share with us? Any parting thoughts about the research study team?
And I just say before we wrap that for all the researchers out there, when you are doing this work, always remember the families. The families really are your partner. They know their children best. Even when you might not think that the family knows, there are things that they do know. And so really take that into account, because we're going to be our children's biggest advocates, and you want us at the table because we're going to give you that that bird's eye view that I think you need to support more families and children.
That's such a great point, Yetta. And as a researcher, I don't think I've ever been a part of a research project like this that was so community engaged, and it was so incredibly valuable. I think that we very often live in sort of this bird's eye view, like I'm a researcher and I need to just observe what's happening in this very controlled setting, and you just miss so much. And then it takes a long, there's a sorry, in the field, there's like a 15-year gap from doing a research study to actually implementing it in research. And I think across a lot of different areas, there's no documented, it takes about 15 years from when a research study happens for a community to see the impact. And we saw the community impact in the context of the study, and that was really cool to see. And I just can't imagine doing research differently moving forward, right? What's the point of asking a question and finding out something interesting if it's going to take 15 years for it to help the community? And so thinking about ways to really make that partnership bidirectional early on in the research project, it was really cool to see, and to see it be done in a successful way.
I'll just add from the clinical side, you know, this is like a space that doesn't, there's no, you can't, sorry, child. They know enough now. I'll just say from the clinical side, there's no insurance reimbursement for this, for what we're doing. Like, it's very hard to get time to focus on, you know, the gap, as Yetta says, you know, and it's such a important focus. It enhances clinical work. It enhances the early education work. It's just so critical to work in this space. So it was very fun to be a part of. I hope we do more of this work. I know we will, and I know we're trying to be innovative here, but just huge value added in this little niche, which that gap is always there. Even though the child is kind of floating in and out of those settings, there's nothing really supporting that that niche, unless we have projects like this. So very happy to be a part of it.
Yeah, I would just echo that. Thank you to the CTSI for funding this and allowing this opportunity. We're very grateful for.
Well, thank you so much for taking this time to talk to us. It is such a great honor for you guys to even share it, and it's great to see the collaboration with the community partners. So it's, and with research, and it's, you guys, I could see it all in your faces. You're very passionate about what you do, so that definitely helps. So it's an honor. So, thank you.